want to start with something that I should have shared with you a long time ago. I've run over 120 boot camps over the last 10 years. And that's around over 200, 400 people that have come through our boot camps. And every person that has been successful, they learned something very valuable. I know they did because I see it. I see what they've built. But there's a piece of the picture that I haven't shared clearly enough with anyone. And I'm going to share this with you today because a company that I'm working with has given me permission to do something really big that can help change people's lives that we serve, as well as your own. And when I sit down and I look at this and I worked out what this meant for people that I train, I realized that this is something that is going to change everything. So stay with me for the next 15 minutes, because if you want to work in care or you want to build a business in care, then listen very carefully, because what I'm about to talk to you about today is the most complete income model that I've ever taught. Hi, I'm Christine Crowle, and I've been 35 years in care. So let's get straight into it. So, for those of you that are here, that's new, I want to say a quick hi and give you a bit of background about what I actually do and where I come from. I've ran my own care businesses, care homes, for example, and I know what it's like to be responsible for residents and to be inspected by the Care Quality Commission, for example. I've taught in Sussex. I've had my own training schools, and I've been able to teach people levels 2, 3, and 4 in care, home care staff, as well as senior managers in hospital teams as well. And this was through organizations like colleges that I was working with before I got into care. For example, teaching at Chichester Hospital and other healthcare agencies across the region. I've taught at Chichester College and Brighton College as well. And for those last 10 years, I've been running boot camps through the organizations, i.e., for example, teaching business owners how to run and get contracts for their care businesses. And what I'm about to tell you now and explain to you now is because things have changed. They really have changed. And I'm about to share with you something that comes from being inside of the care sector for over 35 years. So please do stay tuned, because you're not watching it from the outside. I'm not showing you theory. This is how it's actually working now. So the problems that care homes face today is that, for example, let's look at the problem, right? I keep seeing this in every home that I have visited, okay? Engagement quality is completely dependent on one person. One person, activity coordinator, is doing all of this, no matter how big or small your home is. Well, that is brilliant. I'm not saying it's not. The home has to do this. Residents need to be stimulated, connected. They need to be enjoying their time in the care home. Families visit and they also see it. Inspectors visit and they see it. So when that person is off sick or stretched or hasn't got the resources that they need, residents have a day with nothing meaningful in it. So nobody really is recording what happens or didn't happen effectively enough. Some may be, a very small percentage. But let's be real and honest here. Our main focus is the care as well, isn't it? So I've watched this cycle repeat itself over and over again over the 35 years. And I've kept thinking, there has to be a system that works regardless of who is in the room that day. A monthly resource base that's always there. An outcome tracker that captures the evidence that we need. A coordinator who has everything that they need before they walk through that door. That's what I've built. And that's what I want to show you and talk to you about today. So, here's the model, right? I want you to really learn about this. So I'm going to be really specific about the numbers, because I think being vague in income claims are one of the most unhelpful things that when you're in business education. So let me talk to you about exactly how this is going to work. There's 3 income streams and they stack. Okay, stream 1, activity coordinator sessions. That is, we're not providing that service as a care provider. We seem to be thinking about healthcare workers, support workers, nurses. What about providing activity coordinator sessions, adding an additional income stream to your care business, for example? You supply an activity coordinator to a care home. You can charge anywhere between £25 to £50 per hour. The coordinator runs the session with the residents using the monthly engagement pack that I've provided. And there's also a resource base, for example. So at 6 hours a week, at £35 per hour, that's 35 times 6 times 4.5 weeks, for example. If you do this over a month, that's roughly around 903 to £1,000 a month, just with one care home. That is a reoccurring income stream that you can do that's going to help the care home as well as the residents and as well as your business. Number 2, income stream number 2, monthly engagement packs. That is what I supply you with through our services. Every month a pack arrives at a care home containing papers, magazines, puzzles, residents' interest, large print puzzle packs, reminiscence and conversation cards, friendly activity sheets, seasoned themed content, and an engagement outcome tracker for CQC evidence. That is the enhanced pack, which is the most popular. You can be charging $847 a month for that. Now add those 2 income streams together, the £903 a month coordinator income plus your income activity pack of say £147 a month. 1 care home, 1 month. You bring that together, that's £1,750 a month, reoccurring every month just from 1 care home. Now think about this. If you had 3 care homes, that would be £250 a month. 5 care homes would produce £8,750 a month. then 10 care homes would produce 17,500 a month. Just think about that. Just think about what I've just said to you. That's not a side income. That is a business model. Stream number 3. And this is the one I want you to spend a moment in thinking about, the commission that you can get from providing these activity packs. So like I said, I have put together these activity packs along with the activity tracker for care homes to use as evidence-based to show their CQC inspector that they are doing these activities, and these are the outcomes, these are the residents, and this is what the score is for each of those activities and each resident, what and how it benefited them, what changes have happened. So think about the income streams. You can really be conservative. You don't have to go huge. But think about if you was to provide to, say, 30 care homes a month, what income stream that can bring to you as well with these activity packs. And that is the most effective way of earning an income, and it's a win-win situation for everyone involved. So imagine earning that monthly income, residual, month after month after month. Just think about that, what that can do for your business. So whether you're working that month or not, you're getting residual income. You haven't got to keep working hard all the time. You're working smarter, not harder. Now, here's the part that connects everything. I can't reach everyone in the UK. I can't reach everyone on my own. But the people that I can train through this by me offering the bootcamp can. Every bootcamp attendee who goes on to supply these packs and the coordinator sessions to the care homes and sources them through me, the activity pack, this is going to add you value. You get commission as well. Imagine we're training you to provide this service. It is not a saturated service. It is undervalued. It is not being seen enough. Imagine doing 3 care homes a month. Or even if you was doing, for example, by year 5, you could have 1,000 care homes running this in the background every single month for you and your business. I suddenly got an epiphany that made me realize that this is what we should be focusing on right now, because things do change in care. So join me for the June bootcamp. It's on the 15th of June to the 18th of June 2026, 4 days live, and it's only £497. I'm going to teach you this complete model from scratch. Day 1, I'm going to talk to you about the business model for you by you providing these activity packs, and why care homes need this, and why now more than ever is the right moment. Day 2, building and selling monthly packs. What goes in them, how to source them, and how to price them, and how to sell them to care homes. We'll be doing that live as well. And this includes newspapers, magazines, as well as the puzzles, the large prints, the activity packs. Day 3, I'm going to be talking to you about AI and how to personalize them to each care home. So the content is personalized for each resident. Generating activity sheets, I provide you with the templates. You'll save hours each week, and you'll get hands-on and practical immediately, so that you'll be able to leave the bootcamp and use it straight away. Day 4, clients, coordinators, and how to grow this. How to sign your first care home client. How to bring a coordinator into the model, and how to handle the same sales conversation with a care home manager. We provide you with the scripts, the pitch deck, and everything that you need. Every attendee goes into this, they will get as a bonus a starter pack, an activity pack template, AI prompts and tools, and also sales scripts for care home. And also, I'll be talking to you about engagement outcomes tracker ready for you to hand to clients, and also monthly marketing materials. Everything that you need to launch with your first client will be immediately available to you on day 4. The price, £497. That's it. No upsells, no hidden extras. You'll also get the replay included, so if you miss a session, you won't lose out. You can still listen to the replay. But here's what I want you to do before you book. I want you to book a free 20-minute with me first, or my team, because this works here. It really does work, and it works best for the right people in the right businesses. And I'd rather have a quick conversation with you to tell you honestly if this is going to be right for you before I take £497. And I want you to be able to sit through with me for the 4 days, so that you ensure that it's relevant to you. This call is free, it's online, 15-20 minutes, and I will give it to you straight. The link is here in the description and also pinned in the comments below. So join me, and I want to be able to share with you this new asset that I've learned about. It is truly amazing. So speak with you soon. Take care. Thank you. Goodbye.